Well, I think one of the big positives of the Obama health plan is the prevention initiative. I think that it's quite timely at a time that we're talking about a reduction of tobacco consumption, that we talk about other type of lifestyle choices that are really not being addressed. We can work to avoid things like osteoporosis, cancer, hypertension, addressing issues like obesity rather than treating the symptoms of obesity is one of those things we've got to do. The question is, does the administration in Washington have the intestinal fortitude, let's just say the guts, to tell people that they've got to participate in prevention themselves? They can't just say, I have a right to do all of these things, to smoke, drink, overeat, but you have a responsibility to pay my bills. I think we're going to need to have a major reform on prevention, much like we did with welfare reform, of actually telling people the recipients have to be part of the answer. I think one of my biggest concerns is not really appreciating the huge cost. We're talking trillion, 2 trillion to start with, and the huge level of cost there, and where is it going to come. And the centralizing of power into Washington. Frankly, I'm much more comfortable with Governor Romney's proposal at addressing major healthcare at state level. So then we have many different programs we can choose and correct and see what works or doesn't work, much like we did with welfare reform, rather than asking Washington to create a one-size-fits-all for over 350 million people. And I think this isn't what's being discussed. This will be the largest healthcare system in the world since Russia. And I think we saw what happened in Russia, and we don't want to follow that model. That, when you talk about France, you're talking maybe 60 million people. When you're talking England, you're talking about 50. We're talking a huge healthcare system, one-size-fits-all kind of concept that could have terrible repercussions if it's not done appropriately. And hopefully we'll see a cooperative effort following our federal system in this country that allows states to lead rather than asking Washington to dictate. I haven't seen very much input at all being either requested or provided by the Republicans on these health care packages. It's almost as if you don't agree with the line of either the majority or the White House. You're not really asked to participate. They don't want discouraging words. I think that creates a problem of all or nothing kind of attitude, and that never lends itself well. I think one of the great successes we had in the 90s was the give and take process between the Clinton administration and the Republicans in Congress that actually created a finished product that was much better than would have been done by either side by itself. I think we've got to recognize that we've already seen a major portion of the automobile industry, the banking industry, and the finance industry, and now talking about the health industry, coming under the control or the oversight, direct oversight, but basically the control of the federal government. This is a huge step that the Founding Fathers never perceived, and that's one reason why I think we need to take pause and not be bullied or rushed into a decision that is not only going to affect our lives, but our children, our grandchildren, and our great-grandchildren. So I think it's one of those things that we really need to take a look at, and sadly, I think that there are those who are looking to use a crisis to exploit the situation, to move an agenda that they felt strongly about moving long before we had a financial issue. And I still have a major question to the White House of their justification of using the financial crisis as an excuse to commit a $1 trillion to $2 trillion in the short run and many trillions in the long run expense at a time where we don't have the money to pay for what we have already committed to. How do we justify making the next leap just based on faith? I think that's a question that not only the Congress should ask, but the American people. Well, the county supervisor really helped me to sort of move beyond just being a father or being a recipient of health care, but actually being a provider. Providing one of, a county larger than 20 states of the union, healthcare really sensitized me to things like tort reform. You can't expect to provide affordable health care to the needy without getting the trial lawyers out of the operating room. We were providing services for poor women to have healthy babies, and at that time we were having doctors who were volunteering, having to have almost $100,000 with insurance that could have gone to direct services for the needy and to health care rather than going to the lawyer, paying tribute to the trial lawyers. So I think the county service really gives me an advantage that most members of Congress don't have.